this is how you suction a patient. So first off, you need to monitor the patient, look for any indications for needing to suction your patient. Some indications could be on your monitor, you see a sawtooth-like pattern. If it's a pressure-oriented ventilator, then you would see a decrease in your tidal volume, and if it's a volume-oriented ventilator, then you would see an increase in your peak pressure for your patient. A couple other indications could be you could actually see some of the sputum in the airways itself. You could also hear some coarse crackles in the tracheal region. Another thing that you could do is you could look at your SpO2, and if you see that it is going down, or you notice that your ABG lab results are deteriorating, that would also be an indication that you need to suction. So once you've indicated that this patient needs to be suctioned, you would then obtain all the equipment that you need. Most of the time it's going to be in the room. So you would need the vacuum regulator, your nice little collection jar, which would be attached to the patient to the actual closed suction system. Once you have obtained all of the equipment that you're going to need, you would then review the patient's chart if you haven't worked with them in the past to just see how they've handled the suction, if any sputum has come up, what color it is, things like that. After I've done that, I'm going to introduce myself to the patient, tell them why I'm there, explain the procedure if they haven't had this done before. For example, Mr. Jones, I'm Erin, I'm a respiratory therapy student. I'm going to suction you, and hopefully we're going to get all that stuff out of your lungs so you can breathe better. Once I've done that, I'm going to wash my hands, I'm going to glove up, trying to keep it as clean as possible. I'm then going to position my patient into a semi-Fowler's position. It's not really possible for this demonstration, but we're going to pretend. I'm then going to check my equipment and make sure that it works. On the vacuum regulator, it should read between -150 and -100 millimeters of mercury. That might not always be accurate, so another thing that you can do is you can disconnect this, put your thumb over, and a seasoned respiratory therapist would be able to tell if that is the correct pressure or not. Make sure that you reattach that really well. So next, I'm going to look over at my patient's monitor, make sure that heart rate, the rhythm's okay, respiratory rate, intracranial pressure, SpO2, just making sure that my patient is okay and that I don't have any contraindications to do the suctioning at this time. Once I do that, I'm going to unlock the thumb port. After I've unlocked the thumb port, I'm going to hyperoxygenate my patient for about 30 seconds. There's a setting on the ventilator which you can do this. 30 seconds or more is what I should say. So another thing that we could do before we suction the patient is you could lavage them, but that's only indicated if they have like thick secretions, and what you do is you would just put some saline into the system and squirt it while they're inhaling. So before I suction them though, I'm going to inform the patient. So like, Mr. Jones, this is going to make you cough. That's pretty important. So now that I'm actually ready to suction the patient, I'm going to secure the airway with one hand, and with the other I'm going to force the tubing down. It's important to say that once I hit the carina, the patient's going to cough, and I'll actually feel that kind of obstruction. So before I start applying the vacuum, I'll pull the suction out a little bit, about 1 centimeter. This entire process of putting the tubing in and pulling out should take no more than 15 seconds. And while I'm doing this, I should be continually looking at the monitor and making sure that my patient's doing okay. So I've hit the carina, I pull back a little bit. I'm going to intermediately start applying while twisting. Make sure that comes all the way out. And I should be looking at the monitor the entire time. So after I've done that, I'm going to hyperoxygenate the patient again for a minute or more, making sure that his stats are doing okay. I am then going to be auscultating, making sure that maybe like those crackles have cleared up, things like that. If I've determined that there isn't a need to suction again, what I could do is I could clean out this tubing. More importantly, I would turn off the thumb port. I am going to take off my gloves, wash my hands, and lastly I'm going to chart how the patient handled the procedure, if they did have any sputum, like the color and the quantity, and I'm also going to go ahead and tell the nurse that I did this and just talk to them and make sure that they know how the patient is doing.